Hello, everyone, and welcome back. Today, we are diving into an important group of disorders found in the DSM-5 TR known as disruptive, impulse control, and conduct disorders. Just a quick disclaimer, this content is for educational purposes only, and it's not intended to substitute a medical or psychiatric advice, diagnosis, or treatment. Please always follow your facility protocol and provider orders. These disorders often begin during childhood or adolescence and can significantly impact relationships, school performance, occupational functioning, emotional regulation, and overall quality of life. As future PMHNPs, it is essential that we understand how to recognize these disorders and differentiate them from one another, and so we can identify evidence based treatment approaches. One of the biggest challenges in psychiatry is that symptoms often overlap. So, a child who argues with parents may have oppositional defiant disorder, ADHD, anxiety, trauma related symptoms, or another conditions. A teenager involved in fights may have conduct disorder, intermittent explosive disorder, substance use issues, or an underlying mood disorder. This is why accurate assessment and differential diagnosis are so important. Today, we will review the oppositional defiant disorder or ODD, the conduct disorder or CD, intermittent explosive disorder or IED, and then we'll talk about pyromania and kleptomania. We will talk about diagnostic features, treatment options, our nursing considerations. So let's get started. Now let's begin with the oppositional defiant disorder. ODD is characterized by a persistent pattern of angry or irritable mood, argumentative or defiant behavior, and vindictiveness. Children with ODD frequently lose their temper and become easily annoyed. They often argue with authority figures such as parents, teachers, coaches, or caregivers. Many refuse to comply with requests, challenge rules, and deliberately annoy others. Common characteristics is blaming others for their mistake instead of accepting responsibility. Some individuals do not have accountability, and some become spiteful or vindictive toward others. These behaviors must persist for at least 6 months and cause impairment in social, academic, or family functioning. One important concept is that ODD behaviors are usually directed toward authority figures. The child often knows the rules but actively resists following them. ODD is not simply a child having a bad day or occasionally arguing. The pattern is persistent, disruptive, and significantly interferes with functioning. Treatment often includes with parent management training, cognitive behavioral therapy, family therapy, school interventions. As nurses, we focus on maintaining consistency, avoiding power struggles, reinforcing positive behavior, and supporting healthy communication. An important pearl is that ODD involves defiance and irritability, but does not involve serious violations of the rights of others. And that distinction becomes very important when comparing ODD to conduct disorder. Now, for conduct disorder, it's more severe than oppositional defiant disorder. While ODD involves arguing and defiance, conduct disorder involves repeated violations of the rights of others and major societal norms. Individuals with conduct disorder may demonstrate aggression toward people or animals. Examples include bullying, fighting, threatening others, using weapons, or cruelty towards the animals. Another category involves destruction of property. Examples include vandalism, breaking in windows, or setting fires. Deceitfulness and theft are also common. Individuals may lie, manipulate others, break into buildings, steal valuables, or engage in criminal activity. The final category involves serious rule violations. Examples include the chronic truancy, repeatedly running away from home, staying out overnight despite the rules, or engaging in illegal activities. Unlike ODD, conduct disorder often results in legal problems, school suspensions, social difficulties, and community system safety concerns. Conduct disorder is also associated with increased risk for substance use disorders, criminal behavior, violence, academic failure, antisocial personality disorder later in life. Treatment is often multidisciplinary and may include the cognitive behavioral therapy, parent training, family therapy, school interventions, multi-systemic therapy. As nurses and future PMHNPs, safety assessment becomes extremely important. We evaluate risk of harm to self and others, substance use, trauma history, and environmental influences. Conduct disorder involves violating the rights of others, while ODD does not. Now, for the intermittent explosive disorder or IED, this is characterized by recurrent impulsive aggressive outbursts that are disproportionate to the triggering event. These episodes occur suddenly and without planning. Examples may include yelling, screaming, threatening behavior, throwing things, property destruction, physical aggression. The outbursts are much more intense than expected for the situation. For example, someone may punch a wall or punch a person because they misplaced their keys. Another person may become physically aggressive after a minor disagreement. The key feature is impulsivity. The aggression is not premeditated, it is not done for revenge, financial gain, or criminal intent. Episodes are usually brief and often last less than 30 minutes. Following the outburst, many individuals experience guilt, shame, embarrassment, regret, and the treatment typically includes the cognitive behavioral therapy, anger management training, stress reduction techniques, relaxation training, SSRIs when indicated, mood stabilizers in selected cases. The nursing interventions include helping patients identify the triggers, teaching some coping skills, and promoting emotional regulation. You may ask, what separates conduct disorder from intermittent explosive disorder? The answer would be that conduct disorder involves a persistent behavioral pattern, while IED involves impulsive, aggressive episodes. Now, for pyromania, it is a rare impulsive control disorder which is characterized by repeated, deliberate fire setting. Individuals with pyromania are fascinated by fire and often spend significant time thinking about it. Before setting a fire, they experience increasing tension or emotional arousal. During the fire setting act, they often experience excitement, pleasure, gratification, or emotional relief. Afterward, some individuals may experience guilt or remorse. One of the most diagnostic patterns and points is that the fire setting is not done for money, revenge, political reasons, criminal concealment, attention seeking, or psychosis. Instead, this behavior is driven by fascination and emotional gratification related to fire itself. Examples may include setting fires, repeatedly, even the small ones, collecting lighters or matches, spending excessive time watching fires, seeking opportunities to observe the firefighters. Treatment focuses on cognitive behavioral therapy, impulse control training, family support, safety planning, restricting access to fire starting materials. The nursing priorities for this include the risk assessment, patient education, family involvement, and community safety. Pyromania is driven by fascination with fire and not for criminal intent. Now, for kleptomania, this is the final disorder that we will talk, and it is characterized by recurrent failure to resist urges to steal items that are not needed for personal use or financial gain. This is not ordinary theft. The individual usually does not need the item and often could afford to purchase it. Before stealing, tension begins to build and the urge becomes increasingly difficult to resist. During the theft, the individual experiences relief, gratification, excitement, or emotional release. Afterward, feelings of guilt, shame, regret, and embarrassment commonly occur. Many people never use the stolen items. Some hide them, they discard them, or even return them later. Common items may include cosmetics, pens, keychains, clothing accessories, books, and small household items. The behavior is driven by the emotional experience rather than the value of the object. Treatment typically includes cognitive behavioral therapy, impulse control training, family support, relapse prevention strategies, the SSNRs when appropriate. As nurses, we should approach patients without judging them. Many individuals experience tremendous shame and fear after their behavior. Building trust and promoting healthy coping skills are essential components. And just a final reminder that kleptomania is driven by internal urges and emotional tension, not by financial need or gain. So now let's quickly compare these disorders. ODD involves defiance, irritability, arguing with authority. Conduct disorder involves the right violations, aggression, theft, property destruction. Intermittent explosive disorder involves sudden aggressive outburst, impulsivity, remorse afterward. Pyromania involves fire setting behaviors, fascination with fire, emotional gratification. On kleptomania, it involves recurrent stealing, internal urges, relief after theft. Although different, all of these disorders involve impaired impulse control and can significantly affect functioning. Thank you for joining with me today on the Doodle Nurse. Understanding disruptive impulse control and conduct disorders, it's essential for providing safe and evidence-based mental health care. As future nurses and PMHNPs, remember that early identification, comprehensive assessment, and family involvement and individualized treatment can dramatically improve the outcomes. Most importantly, behind every diagnosis is a person which deserves dignity, understanding, and support. If you found this content helpful, please don't forget to like, subscribe, and share it with your classmates. Until next time, keep learning, keep growing, and keep making a difference. And once again, this content is intended for educational purposes only and should not replace professional medical and psychiatric advice, diagnosis, or treatment. Please always consult a qualified healthcare provider regarding medical or mental health concerns and always follow your facility protocols.